Welcome to Therapy by Choice podcast. My name is Robyne Vance. I am your host for this podcast and an associate marriage and family therapist working with individuals, couples, and families. My therapeutic services are offered through Therapy by Choice, which is a private practice with offices located in San Jose and Palo Alto, California. On this podcast, we offer educational information on a variety of mental health topics. We speak to specialists in the field, and we answer your questions. We focus on helping you navigate life's challenges and offer easy-to-follow practical advice and opinions. Welcome to Therapy by Choice podcast. My name is Robyne Vance. I am so excited for this episode, which will explore the field of psychiatry. My guest today is Evelyn Ashiofu, MD, MPH. She's here to talk to us and educate us on psychiatry, and we'll be discussing the connection between psychiatry and therapy. We'll talk medication management and treatment, just to name a few of the topics we'll cover. We're tackling some interesting stuff today, and there's some good information and insight coming your way. And this episode will be filled with things you'll want to remember and share with someone. Dr. Evelyn Ashiofu, warmly known as Dr. Ev, is a double board certified adult and child psychiatrist, mental health advocate, and the dynamic founder of Girl, Choose You Incorporated, a mental health and wellness brand empowering women to prioritize their mental health unapologetically. Based in New York City, Dr. Evelyn blends clinical expertise with cultural insight to destigmatize mental illness and make conversations about therapy, medication, and self-care accessible and relatable. She's also a content creator known for breaking down complex psychiatric topics on social media while showcasing the vibrant, multifaceted life of Black women in medicine. Whether she's in the ER, on stage, or on your timeline, she's on a mission to help people, especially high-achieving Black women, protect their peace, heal loudly, and choose themselves every day. What's good, Dr. Ev?
Hello, Robin. Hello. Hi, everyone. Thank you so much for having me. I'm so happy to be here.
Yeah, I just want to thank you so much for being being a guest, and you're also the first psychiatrist on Therapy by Choice podcast.
Oh my goodness. I'm so honored and so happy that you have this platform really to shed light on issues and topics that I think are so important. So thank you.
And I actually found you through your social media content, What's Good, Dr. Ev. And I really admired and I appreciated how you framed your message in such an easy to understand way. And it really connected with me because on this podcast, a big part of my platform is providing psychoeducation. And I really try to make mental health easy to understand. So for me, it was just really awesome to come across someone who had like a similar mission as myself, and I had loved the way you presented your content.
Well, I really appreciate it. That's honestly the goal. I really want to get this information out to the masses, and I want to do it in a way that is not boring, that is entertaining, that could be fun. But at the end of the day, there's a message to take home. And so I'm so glad that you came across my content and that it resonated and that it did what I was hoping, or intending for it to do. So I really appreciate that.
You're welcome. Now, I will say my first introduction to psychiatry, and this may date me a little bit, but that's okay, was Frasier, the show Frasier.
Mhm.
And so, like, in my mind, it was like, probably what most people think, like the picture of someone like laying down on the couch, while someone kind of sits there and listens to what you say and analyze you. But can you give our listeners a really good rundown on what exactly is psychiatry, and also like how does it differ from psychology or therapy?
Yes. That's a really good question. That's honestly a very common question as well. Um, And so psychiatry basically it's a medical specialty, right? So it's
Mhm.
focused on diagnosis, treatment, and prevention of mental health disorders. So I think the biggest thing is to notice that psychiatrists are physicians.
Mhm.
We attend medical school, and we are really trying to get at the sort of medical complexities of mental illness. So prescribing medications, treating psychiatric illness medically in that way, ordering lab tests and interpreting those results from the lab test. We're also looking at the biological aspects of mental illness. And so I
Yes.
think those are the ways that psychiatry differs in from psychology, right? Whereas psychology
Mhm.
is the study of of human behavior and the mind. Um, and they're also, of course, using or utilizing testing, research, but that sort of medical biological is not uh typically not the area of their expertise, whereas psychiatrists who can also, um, do psychotherapy as well, the expertise really comes in that medical biological approach to mental illness.
Wow, that's actually a really good way to encapsulate that. So, I guess it's, when we talk about like, hey, this is a medical doctor, and we know that this is for mental health, what types of conditions or concerns would someone approach a psychiatrist to typically treat?
Yes. So honestly, any sort of mental illness or mental disorder, because we know that there is a biological aspect, many mental illnesses and disorders are multifactorial, meaning there are many different factors that can lead to the emergence of mental illness.
Hmm.
Because we know that most of, if not all, mental illness have some sort of biological component, psychiatrists really can treat any, mental illness, any mental disorder. Um, the most common ones that most psychiatrists will treat is like a general adult psychiatrist. We're thinking depression, anxiety, more serious mental illnesses such as schizophrenia or bipolar disorder. Um, like you mentioned earlier, I'm also a board certified child psychiatrist. And so some of the more common pediatric psychiatric disorders are ADHD,
Hmm.
autism, we're eating disorders. And so there's several different illnesses, but I will say because of that aspect, right? Because there is a biological component to a lot of these illnesses, psychiatrists are equipped to treat them all.
Yeah. And I'm looking forward to also kind of talking about some of those more emerging illnesses that you spoke of, like ADHD and depression, a little bit later on in our conversation.
Definitely, definitely.
And I know when I think of like a doctor, I automatically imagine, there's a lot of time and effort and years of schooling it requires. So, what kind of training does a psychiatrist go through? I know, of course, as a therapist, we have, our undergrad, and then we have master's level education. Then we work towards, licensing. But what does that training and education look like for a psychiatrist?
Absolutely. So we'll talk like kind of post high school. You obviously need your undergraduate degree, and so 4 years of college, and then medical school, which is another additional 4 years of
I got it so far.
exactly. Let's, keep count. And then so after we do the 4 years of medical school, we do what's called residency. And so that is where you get your specialized training when you decide what specialty you want to go into. So
Mhm.
that's obviously psychiatry, but some people may pick surgery or pediatrics or neurology. So, anyways, it's the specialized training. Um, Typically, it's 4 years for a general psychiatric residency program.
We're at 12. Okay.
At 12, yes. And then if you would like to specialize further in the field of psychiatry, then you would do what's called a fellowship. And
Okay.
so my fellowship, because I am specialized in child psychiatry, that was an additional 2 years of training.
Wow.
Yes.
Okay.
Where are we at? Is that 14, I believe?
14, you're at 14
14,
years.
14 years.
You're there. Wow. And was it always psychiatry for you? Was that like, this is it?
No, actually, that's what's so funny. And I talk about my decision to go into psychiatry a lot on my platforms, but I did not know anything about psychiatry when I started medical school, to be honest.
Mhm.
Um, I didn't know much about mental illness outside of what's probably portrayed in the media, in movies
Yeah.
and TV, and that scared me. Um, so the idea of me working with that patient with the patient population of individuals who struggle and suffer with mental illness wasn't on my radar at all. Um, but thankfully, in the way that medical training is structured, you do have to rotate through all of the main specialties, medical specialties, and psychiatry being one of them. So I rotated through my psychiatry rotation, starting it off knowing like I would never do this. In fact, it's so funny. I'll never forget the first day of the rotation. We were all like in the auditorium and, getting our orientation. And the rotation director asked, who in here is interested in going into psychiatry? And I remember literally looking around. I was like, who's going to raise their hand? Like, who would actually raise their hand to say they're going into it? But anyways, I did my rotation, and my first rotation was actually an inpatient rotation. And
Mhm.
that. And so for those who are not aware, this an inpatient psychiatric unit is, definitely um for individuals who are kind of acutely suffering with some sort of psychiatric condition and getting very like acute management of their symptoms. So it's
Mhm.
it's more intense. Uh,
Yes.
and that was my introduction to psychiatry, but I loved it. I
You
loved
got baptized by fire.
it through fire, through flames. And I absolutely loved it. I loved the thinking that went into it, the discussions that we had to have. It was the first rotation where I felt like, oh, a lot of these other factors really do matter as far as like where someone is living, who someone is living with, what are their connections like, what is their social life like all of these things also contributed, as well as the biological genetic factors of mental illness. And so I felt like I was really using my knowledge, like I was really
Yeah.
gaining knowledge, becoming more versed in all of the different ways that mental illness can present itself. And I really appreciated that. I also what did a consultation rotation as well. So where
Mhm.
we act more as the consultant versus like us being the primary treatment team of a
Yeah.
patient. And that was very interesting because we would be on rotation, and it would be different medical specialties consulting psychiatry, like from OB-GYN to cardiology and surgery. And it just was very eye-opening for me, because I was like, whoa, like all of these patients that we're being consulted on have these very serious medical conditions, right? Um, but if they were not doing well mentally, or if they weren't doing well, like psychiatrically speaking,
Mhm.
it really wouldn't matter what treatment the cardiologist or the OB-GYN or the surgery was giving the patient. It was like we couldn't. That was like the tough barrier, It was like,
Yeah.
mentally, if this patient is not doing well, it really wouldn't matter. They're not going to get better,
Yeah.
and
Treat the crisis first.
you have to treat the crisis first. And that's when I realized, I'm like, oh, we are doing very important and good work. And so the rest was pretty much history. I did some child psychiatry rotations, and then I was like, okay, yes, this is my jam. This is where I need to be.
Well, that's just amazing to hear. I know I actually cut my chops in inpatient psych. That was actually my first major kind of entry into the field of mental health, and I can tell you, um, I feel, we know it's the highest level of care.
Right.
So anything below that, I feel like it really helped make me a very well-rounded clinician. And I really got the chance to work with some amazing psychiatrists who really took the opportunity to kind of, you know, let me know how the unit was. Dr. Offwall, my favorite psychiatrist of all time, Dr. Patan, some other really amazing psychiatrists that I worked with. And when I was in inpatient psych, one of my favorite parts of the day was treatment team. Every morning. And I really love that kind of like multidisciplinary approach to operating on the unit. So, when we talk about the relationship of like psychiatry and therapy, right? We know that they complement each other in treatment. Um, how does psychiatry and therapy, work together or complement one another? And are there things that you believe that they could do, like, someone like myself and you can do to get better patient outcomes?
Yes, absolutely. And I agree, Robin. That was one of my favorite parts of the rotation too, and the multidisciplinary aspect and approach to treatment. I think honestly it's the gold standard. If there's any way to make sure that a patient is receiving both like psychiatric interventions as well as psychotherapeutic intervention, I think that makes room for having the best possible outcome. Uh, because we approach things differently, and it
Yes.
goes back to the question of, what is the difference between a psychiatrist and psychologist? And that's exactly it. It's like, why not have a team that's approaching the same illness or condition or disorder, but approaching it in different ways that are both, you know, evidence to improve outcomes.
Hmm.
I currently in my role, like working in an emergency room, we have a very good team of psychologists and social workers. And then
Yes.
we, I am so dependent on our psychologists and social workers for the things that they're experts on, right? And
Hmm.
so I can't imagine, I can't imagine only approaching patients in one way. Sometimes,
Yes.
unfortunately, just because of access to services and things like that, sometimes that ends up being the case. But I wholeheartedly believe, like, if we do want the best outcomes, if we do want to put our patients in the best positions to succeed, approaching
Hmm.
in different ways is the gold standard, and that would be working very closely with psychology as well.
Yeah. And what I would tell, my patients that were on my unit is, what we got to have good mental health, right? And we got to figure out how we're going to manage our mental health. And so, we know that, hey, I gotta take my medication, right? And then maybe I gotta talk to someone. So
Yes.
it's kind of like, hey, those two together are, how we can try to improve or manage for you to have better mental health or good mental health.
Absolutely, absolutely. They really do go hand in hand.
Yeah. And outside, obviously psychiatrists work outside of inpatient as well. But I think a lot of times people have a confusion about like, hey, do I start at like if I feel something is going on with my mental health, do I start by talking to my primary care doctor? Do I go to a psychiatrist first? When should someone see a psychiatrist instead of or in addition to a primary care doctor?
Yes, yes, that's a good question. Um, I'll be honest, because of how, the percentage of individuals who struggle with mental illness or have a treatable or diagnosable mental disorder is so high, right? Um,
Mhm.
there's I believe like 1 in 5 adults will be diagnosed with a mental disorder in a year. So it's
Wow.
very, very there's a very high percentage of people who would benefit from psychiatric treatment.
Mhm.
And I say that to say that more times than not, their first sort of interaction or presentation to address any sort of mental health concerns will be their primary care doctor.
Okay.
And that is why many primary care doctors, family medicine doctors, internal medicine doctors, pediatricians, they have some level of ability to treat more common, less acute mental health concerns. So I will say that, like, a lot of times primary care doctors are the ones who are managing mental health concerns. Um, when is it time to now look at seeing a psychiatrist? It's going to depend
Mhm.
on a few things. Um, Now, how serious is this mental health concern? Like, has it gotten to a point where it's sort of past the comfortability of the primary care doctor? And they will know, right? Usually, when seeing a psychiatrist comes from a referral from a primary care physician. So
Mhm.
they have sort of made the decision that they're not able to manage the patient appropriately, and they need sort of a more specific or specialized care. So that is one thing to consider. Uh,
Yeah.
how serious is the mental health concern? So is it this an acute thing where it's like someone may be like acutely manic or acutely depressed, where there's more like unsafe or more concerning behaviors or thoughts that are happening? Um, that might that would probably require the expertise of a psychiatrist versus a primary care physician. Um, and I would say too, it's like, how long has the mental health condition been occurring? So is this something where the primary care doctor has been following the patient for several months, and there's not really been much of a change or not much of an improvement? Then that may be time now to look at a psychiatrist as the one to help manage the symptoms. So it really depends on like the severity, the intensity, the duration of the illness. And I will say too, some, like, because most people have a primary care doctor, so like I mentioned,
Mhm.
that's who they're going to see first. But if there's any interest in just going straight to a psychiatrist, I believe that's also an option. I think sometimes, especially in this day and age, it can be very hard to find a psychiatrist, and so going the route of the PCP can be a little bit easier. But, still, if that is what someone wants to do and just go straight to see a psychiatrist, that's
Mhm.
never a wrong thing to do, and I think that's just what I want the take home message to be. But yeah, those are some of the reasons I would consider a psychiatrist, rather than a PCP.
Well, you dropped some gems there. I'm over here taking notes myself.
Oh, good, good. I'm so glad.
Yeah, some of the things you mentioned, I had actually like completely forgot about. So look, this is
Oh,
why we have these types of conversations.
yes, just exactly, literally the reason. I'm so glad.
Well, kind of segueing, because I do want to talk about medication, right? We sometimes we got to have a bit of medication.
Mhm.
How do psychiatric medications work in the brain?
Yes. So the way they work is we are through research, through evidence-based research, right? We have come to see patterns in people who have been diagnosed with depression or anxiety or any other, mental illness. And there are certain, I'll call them brain chemicals, but they're like neurotransmitters, modulators in the brain, that have really big implications when it comes to things like our mood, our emotions, our behaviors, our sleep, our motivations to do things, our movements, you name it. There's something in the brain that controls it, right? Uh, so through our research, we have found that certain individuals who are diagnosed with depression or present with depression or anxiety, there are certain brain chemicals that are off, as far as like maybe lower in some areas of the brain or higher in some areas of the brain. And so what psychiatric medications aim to do is to correct that imbalance that we are seeing. So
Yes.
that's exactly what it's trying to do. So I'll use an example of depression because that's a very common one. And I
Mhm.
people may be familiar with different SSRIs or antidepressants. Um, and so what we have come to see through research is that individuals that struggle with depression tend to have lower levels of serotonin. Uh,
Yes. Mhm.
and serotonin is that brain chemical that helps to modulate a lot of different things, including emotions and sleep. And so what antidepressants are aiming out to do is to increase those levels in the brain by working on different parts, different receptors. And I don't want to get too sciencey, but they work on the antidepressant works on different receptors in the brain to help increase the amount of serotonin in the brain, which then would help to manage those depressive symptoms or the outcomes of depression that we see because there's too low of levels of serotonin, if that
Yes.
makes sense. So that's essentially every psychiatric medication. That's essentially how it works. It's helping to try to fix an imbalance that we're seeing and therefore
Mhm.
the results of that imbalance.
I really enjoy how you just make it plain because this is the type of talk and speech that I give to my clients when I'm trying to explain without over explaining, or even an inpatient when you're trying to get family members to understand, like, hey, what's going on. I always say, like, we have our clinical speak. And sometimes, that works in a sense, but sometimes just really explaining it in an easy to understand way. I say brain chemicals too. We all have our brain chemicals, right? And then if
Right.
I feel, as people can understand it, I'll break it down a bit.
Yes, yes. Yeah, I think that's such a great approach, especially in those sort of acute settings. I mean, outpatient as well, but like making it as plain as possible and more simple is so important. I know for me, like if somebody just started talking at me about, I don't know, like neurosurgery and trying to tell me stuff about that, I would just be like so turned off and I wouldn't even want to listen anymore. I would still have a lot of hesitation. So I try to put myself in their position. Like, how can this be explained to where it makes sense? But still like getting you the information, right? So
And I know this next question is a little bit I think a little bit tricky.
mm,
From a therapeutic side, when I'm giving therapy, whether it's individual, couple, sometimes a family, and we're talking about someone who's struggling with a mental health condition, whether short term, or something longer term. um I know there's a lot of hesitancy to start medication. And so what I try to do is I try to, give autonomy, of course, to the client. And I try to explain, well, hey, how about we do a little bit of therapy first, right? And let's see if what that does to some of the symptoms that you're reporting. But, hey, if we see that, our symptoms are unalleviated, then maybe it's time to go to the doctor, right?
yeah.
So, you know, at what point, like, how do we decide, or how do you as a psychiatrist decide when medication is necessary for someone's treatment plan?
Yes, it's a good question. Um, I definitely I will say I definitely am one who takes the approach of like the least intense.
Yes.
I'm putting that in quotes.
Yes.
uh,
Yes.
the least intensive intervention first,
Yes.
before going on to the next step. So I would, if there's any way that it's possible to start with psychotherapeutic interventions, I'm all for it, right? When what I think it's going to be important to maybe at least start to consider medication treatment. It's sort of like honestly some of the things that I mentioned when it came to when it's time to switch from a PCP to a psychiatrist, sort of the
Yes.
same factors. So let's say that you have been in therapy, everything you've been doing everything you can to keep up with therapy and doing the interventions, but somehow we're just not there yet. Like you've mentioned, that may be time to introduce medications as well. Um, if if there are more acute concerns, So maybe this is like an emergent situation where now
Yes.
we're having, more negative thoughts, more like, we're now kind of concerned about the safety of the patient. So are they at risk of hurting themselves? Are they at risk of hurting others? Um, Unable to care for themselves? At that point, we definitely must consider medications.
Yeah.
Mhm. The other thing I'll mention too is how significant is the impact of the mental health illness disorder, how significant is the impact to the person's functioning, right? Um, are we at a point where now the person or the patient is not able to go to work? Are they not able to go to school? Are they not taking care of themselves? So maybe their hygiene has now took a hit, not cooking, not eating. So at that point, when the impact in overall functioning is declining, I would heavily, heavily recommend implementing some form of medication treatment. And
Yes.
in saying that, I want to say that I'm still a big proponent of doing things in parallel or like complementing each other. So it wouldn't be like, oh, okay, I'm on medications, I don't need to continue therapy anymore. I
Yes.
would not recommend that. I say they need to be done together. And a lot of times, medications, being on the right treatment, medication wise, helps the therapy work better. Right.
Yes, I say that all the time. I try to tell people, sometimes in order for therapy to be effective, we need to remember those chemicals we talked about, right? We
Mhm.
we need to get those chemicals balanced so that way our therapeutic interventions, they actually work.
Exactly.
Yeah,
Exactly.
I totally agree with that. Um, so when we talk about medications, I know that there are, you know, uh, generations of psychiatric medications, and we're getting better at medications, but I think a lot of people think about hey, how long do I have to take these for, right?
Mhm.
Are these, am I taking them for a month? Am I taking them for the rest of my life? When we talk about specifically about medications, so are there differences in a medication that you would prescribe, like a short-term medication versus like something for like long-term use?
Yeah, there are some differences, and it depends really on the presentation of the person, right? Like what exactly is going on that we are considering medications for. Um, so for example, if there's someone who is struggling with pretty significant anxiety and it's because of this like one thing, such as like flying a plane, that's a very common uh
Yes. Mhm.
anxiety provoking event so in that case we would consider a short term therapy. Maybe you just need a medication that's just going to get you from A to B so that you are able to actually get on the plane, and not have to miss out on doing something that's important to you, whether whatever the reason is for wanting to travel and get on the plane. So that may be an example of more short term um medication management,
Mhm.
versus long term, which would be like someone who, is struggling with a specific illness and is finding benefit from medications, and they're going to sort of stay on it for the foreseeable future. I like to also kind of point out that a lot of mental illnesses, depression, anxiety, bipolar disorder, schizophrenia, these are chronic medical conditions, not much
Yes.
different from high blood pressure, diabetes,
Diabetes. Yeah.
congestive heart failure, some of the more, or, hypothyroidism, hyperthyroidism, some of the more common medical conditions we treat. Mental illness is very similar. And, where, we all, obviously, we always would, me personally, we always like to try our best to, again, the least intensive intervention. I would be remiss if I didn't mention that similar to these chronic medical conditions, a lot of mental illnesses, you do have to sort of be on medication more long term, because the
Yes.
risk of recurrence if you stop medication is pretty high. Um,
Mm.
and so we don't want to put ourselves in a position where you start a medication, you stay on it, you get the benefit and you're feeling better, you stop the medication, and then there's a relapse in symptoms. And
Yes.
and through our research, and again, evidence-based research, we know that that risk for the relapse happening exists, and it's not insignificant. So, I think the approach for me is, after there's been some benefit, depending on, and also I should mention, it depends on the condition. Like, there's some conditions, especially more serious mental illnesses, that I would not suggest stopping medications at all.
Mhm.
Um, but there's some, and again, it goes back to a very individualized approach, like how serious are things going on? What is the impact in functioning? And if there are very dedicated to utilizing other ways of treating, so in therapy, lifestyle modifications, things like that, then we can consider after maybe a year, going
Yes.
down on the
Mhm.
dose of the medication, stopping it, and see how things go, with the understanding that the likelihood of recurrence is there. So that's what I would say about that.
Yeah. And I really want to, look at that piece that you kind of talked about. And, in therapy, when I do know that I have a client that, is also managing medication, I'm very mindful of like, hey, we don't just stop our medication, right? We have to, we include our medical team with that. Did you talk to your psychiatrist about stopping your medication? Because it's about the maintenance. Um, and I think, one of the things I used to see in inpatient all the time with readmission was, oh, hey, I didn't take my medication because I was feeling better. And it's kinda like, you do know you were feeling better because of the medication.
Right, exactly.
It's cyclical, like
Yep. Yeah, other.
yeah. So as far as like, getting someone to like be compliant with the medication, I'm sure, can be a little bit tough sometimes. But I think one of the things I think can be frustrating for people, especially if they don't have the education about the medication, is number one, waiting for it to work, right? And then, hey, what if the dose that I'm on, for example, it's not giving me full benefit and now we have to increase the dose. So, how do you as a psychiatrist monitor if medication is working for someone or if it might need to be changed or increased?
Yes. So, whenever someone is on a medication, we definitely want to make sure that we are having very consistent and regular appointments to do just that, right? To monitor the effectiveness of the medication that we're using. Um, Usually, if this is like an outpatient, like just say a general outpatient clinic with someone who is following with a psychiatrist, I would say most psychiatrists will want to see a patient at least monthly, especially in the beginning. And the way I would use, or what I would use to sort of determine if a medication is working effectively, I mean, a lot of time it'll be self-report from that patient.
Yes.
They will sort of help drive the way the treatment plan is gonna go, because they'll let me know, okay, I'm feeling better, or some of the associated symptoms that we see with these mental health conditions. So I'm sleeping better, I'm eating better, I feel more motivated to do things. Um, I'm able to think more. I'm able to concentrate. I'm doing better at work. I'm doing better at school. So these are sort of the self-reported factors that I look at to determine how well a treatment is working. I can also use my own judgment in seeing a patient,
Hmm.
and that's where what we call the mental status exam. So things that
Yes.
are a little more objective, right? Because self-report is obviously very valuable, but then there's always room for a little bit of bias there. But um what I can also utilize is my objective observations of this patient. So, like, compared to when I saw them a month ago, do they appear, less restless, less anxious? Do they look just brighter in general versus before? Are they Do they seem to be thinking more clearly? Like, is what they're saying to me, am I able to follow because they're not as anxious as they were before? So I can follow their thought process a little bit better. Do they look more put together, meaning kind of as a, and using that as a proxy to like, okay, how well are they tending to their hygiene? How well are they like
Yes.
up and at it and taking care of themselves? So these are the more, and obviously there's some a little subjectivity in that as well, but at least for me, like I can say, I started working with you 2 months ago, and I can see a clear difference or not in how you're presenting to me now, and that will also be something that I utilize in determining the treatment moving forward. um and then I would say the other aspect would be collateral information. So if there's,
Yes. Mhm.
especially in children, but I think in all patients, it'd be good to utilize information from close family members, loved ones, um, getting a sense of how they feel their loved one is doing, can also be used and utilized to help sort of guide the treatment. And so for example, with children, I would obviously want to get the parents' perspective on how they feel their child is doing now that they're have started a certain medication, and that will help as well.
I love some good old collateral, boy.
Yes. Yes, I love it's so good. It's just rich with information if I'm talking to somebody and want to hear what is really going on.
What's really, yeah, I get it. So you spoke a little bit about, hey, what does follow-up look like, right? We maybe want to see you once a month. Um, and it's tough because, when we talk about medications, right? There may be some people that are, hey, I can take my medication myself, right? I'm gonna set a timer. I'm gonna, put it near my vitamins, or I'm gonna put it at my bedside, or I'm gonna keep a pill container. What does responsible medication management look like?
Yes. I would say definitely following up with your appointments, and being very like intentional and consistent regarding coming to the appointment. Um, I would say also, you know, being being the one really to help drive the way your appointments are going to go, meaning like make sure you have the information that you want to relate to your psychiatrist available, like you're ready to speak about whatever
Mm.
symptoms or whatever has happened since the last assessment. That's going to be very important because you want to make sure that your psychiatrist has all the information so that they're best equipped to help you in the way that you need to be helped. um, definitely being intentional about taking your medications the way they're prescribed. That is going to be key. I sometimes I have patients who like we have our follow up, and I'm ready to ask, okay, I started this medication, how is it working? And then they'll tell me, oh, I didn't actually start it. Um, yeah, and it's like, okay, but then I feel like the appointment is almost, no appointment is useless. But I feel like, wow, we missed out on an opportunity to really get a sense of what's going on, because I don't really have anything to assess because you didn't start the medication. And so I'm going to assume that things are the same. And of course, we can explore why that is that the medication started. But yes, taking medications as prescribed consistently is very important for good medication management. So
Yeah. And, when you talk about, hey, maybe, I didn't pick up the medication, right? Which is that
yeah.
flower just sitting in the cabinet, right? I think some of that kind of ties into um, people's thoughts or perceptions about needing medication, right? And I know, for example, in the Black community, we're still trying to make therapy
Yes.
normalized in a lot of ways. So when we talk about, psychiatric care, I think we still have a long way to go as far as, normalizing and destigmatizing care. So, what are some ways, maybe our listeners can help or therapists can help? What are some of the things that we can do to try to normalize and destigmatize this part of mental health treatment?
Yes. I am such a big proponent, as you can probably tell, about just having conversations
Yes.
about mental health treatment, psychiatric medications. I think in order to normalize it, we truly have to normalize it. In the same way that we talk about other health conditions, right?
Mm-hmm.
I think that is the way to really destigmatize um, psychiatric medications. And I completely understand the sort of like hesitation or the fear with medications because I just think there are not enough people speaking about experiences. There are not enough people who know exactly what psychiatric medications are, what they do, how they help. And so the more I think we talk about it and just kind of alleviate that whole like sort of mystical like oh my goodness what is this like what we're taking something and we don't know what it is. I think we just have to kind of reel it in and and really help explain and educate people on what psychiatric medications are and how beneficial they truly can be for people to kind of lessen that fear because we're scared of what we don't know, right? That's like
Yes.
that is the root of fear and anxiety is the unknown. And so the more we know, I believe the more the fear or that barrier will be let down and we can really start to do some really good work and really good healing as well.
Yeah. And I know conversations like this are really just going to help continue to kind of just, push this information out there and make it easy. Again, I really love how you've really made it easy for the listeners to kind of understand and get a sense of what's going on.
Definitely. So I don't say it lightly when I say platforms like yours, this podcast is so important and so needed because it's going to reach people who otherwise probably would not have even thought about, therapy or psychiatry and medications. And so absolutely couldn't agree more.
Yeah. And I think for me, my inpatient experience really did kind of impact that. I'm sure when you're an inpatient, you're dealing with people who are, probably at the lowest point, right?
Yeah.
Or on a 5150 hold. And you have also family members who are trying to make sense of what's going on. And what I found when dealing with my patients, number one, with the state they're in, and also with family, is like making things easy to understand.
Yeah.
Like, hey, what's going on with my loved one? Now, yes, you and I both have the education to speak at a very high level, but when you're in crisis, when you're concerned about a loved one, that's not going to translate. So speaking to someone at a easy to understand level, because then they're also going to go ahead and educate others. If
Right.
I educate my patient, then maybe they go educate family. If I educate my family, maybe they go educate other family.
Right.
So it's just it kind of is that kind of like trickle down that I think is just so important.
Absolutely. I cannot agree more. It's so, so important and that we, take the time to do that, to do that trickle down and speak in a way that's going to be, most helpful to our patients and their families.
Yes. I hope you're really enjoying this episode of Therapy by Choice podcast with my special guest, Dr. Evelyn Ashiofu. Join us next week where we'll talk about things like depression, hospitalization, and collaboration with therapists. Plus, we'll play around of Robyne's random reflections. Until then, my name is Robyne Vance. Take good care. While we hope to provide insight and education, our podcast does not replace therapy, and listening to our podcast does not establish a therapeutic relationship. If you or someone you know are in crisis, please call the Suicide and Crisis Lifeline by dialing 988.